Hello, this is Dr. Sarah Amir, and today we are talking about craniofacial growth and development. We are going to start by knowing what's meant by each one of these terms: growth, development, and differentiation. Growth has many definitions. It's the increase in size as defined by Todd, change in proportion and complexity, or measurable change in morphology. All these definitions means that growth is an increase in the mass and quantity. But definitions of development show that it's more about maturation and progression. Differentiation is a specialization of the cell or tissue. In contrary to growth, it's change in quality, not quantity. So, in simple words, growth is getting bigger in size, development is becoming mature and experienced, and differentiation is having an edge and becoming a pro. Now we are going to talk about the stages and steps of growth. Growth is initiated and determined mainly by the growth hormone. Growth stages are the same for all healthy individuals. There are periods where growth takes a higher peak and occur at a faster rate. These periods are called growth spurts. Growth spurts occur at certain periods of age, but it differs from one person to another. There are 5 stages for growth. The first stage is the prenatal period, from conception to birth. The second stage is infancy. In infancy, we have 2 substages, from birth to 1 month, and this is called a neonate, and from 1 month to 1 year, and here the child is called an infant. The third stage is early childhood, where we have toddlers who are aged 1 to 3 years, and we have the preschoolers who are aged 3 to 6 years. The fourth stage is the middle childhood, where the children are aged 6 to 10 years for girls and up to 12 years for boys. We also have the late childhood, which is also known as adolescence, where children are aged 11 to 18 years for girls and 13 to 20 years for boys. Now we are going to discuss the factors that affect and determine growth. Factors affecting growth include hereditary factors, nutritional status, health or illness, race, socioeconomic status, family size and birth order, psychological disturbances, physical status, and climate. Growth pattern. This means a description of the direction and proportion of growth. Which part grows at which time, which part grows fast, and which parts take a longer time to grow. In children, growth patterns are cephalocaudal and proximodistal. Cephalocaudal means the growth direction is from head to toe direction. Proximodistal means the growth is from inward to outward direction. Cephalocaudal growth describes the growth of the body by comparing the growth of the various parts of the body. In cephalocaudal growth, the greatest development takes place at the top of the body, which is the head, and physical development moves gradually downward. As we can see in this picture, at fetal life, exactly 3rd month in utero, the head is 50% of the body. At birth, the trunk and limbs have grown faster than the head and face, so the head is about 30% of the body. Adult life, head is only 12% from body length. This is because after birth, the muscular and skeletal elements grow faster than the brain and central nervous system, as reflected in the relative decrease of head size. Proximodistal growth pattern is where growth starts at the center of the body and moves towards the extremities. An example of this is the early development of muscular control of the trunk and arms relative to the hands and fingers. As we can notice, a young child can move his arms and crawl, but the skills of fingers like holding fine objects develop later on. Growth curve. General growth includes muscles, bone, and viscera. 40 to 45% of this growth is formed at birth. 70% of it is formed by age of 7 years, then it shows a slight decrease during childhood and acceleration during puberty. Neural cells growth largely attained by the first 6 months of life, with approximately 75% of total brain size attained at 2 years old, and almost completed by age of 5 to 6 years old. But growth of genital tissues accelerates rapidly after the late childhood. It's a bit different when it comes to lymphoid tissue, because lymphoid tissue proliferates rapidly in the late childhood and reach up to 200%. By the age of 18, there is inward curvature and shrinkage into adult size. There are three important concepts of growth that we should know: concept of normality, rhythm of growth, and growth spurts. Concepts of normality. Normal refers to which is usually expected and what's usually seen as typical. Rhythm of growth. Rhythm of growth is about the rate and rapidity of growth, which is most intense and rapid during the first 2 years of life. Growth spurts. As we said before, growth does not take place uniformly at all times. There seems to be periods when a sudden acceleration of growth occurs. This sudden increase in growth is called growth spurts. The physiological alteration in hormonal secretion at these periods is believed to be the cause for such accelerated growth. Accordingly, the timing of growth spurts differ from boys to girls. We have 4 periods of growth spurts. The first one is just before birth. The second one is 1 year after birth. The third one is at the mixed dentition stage, and the last one is a prepubertal growth spurt. The mixed dentition growth spurt differs from girls to boys because girls have earlier growth spurt at 7 to 9 years, while boys have it at the age of 8 to 11 years. The same is true for the prepubertal growth spurt, where girls have the growth spurt at 11 to 13 years, while boys have it at 14 to 16 years. Growth spurts have great clinical significance. They are very important to differentiate whether growth changes are normal or abnormal. They help in time treatment of skeletal discrepancies. For example, in class 2 malocclusion, intervention is more advantageous if carried out during the growth spurt because you can direct the growth to correct the problem. Also, growth spurts offer a prediction for the best timing for treatment and its direction. For example, orthognathic surgery should be carried out after growth ceases and stops, while arch expansion is carried out during the maximum growth period.